Good morning and welcome to the second International COVID-19 Conference at Stanford. My name is Bryant Lin, and along with co-director Dr. Latha Palaniappan, I lead the Center for Asian Health Research and Education at Stanford. 1 year ago, the world was only beginning to learn about COVID-19 and its impact on public health, data and research, our patients and providers, and the most vulnerable among us. 4 leading centers at Stanford, the Center for Innovation and Global Health, the Center for Population Health Sciences, the Center for Digital Health, and the Center for Asian Health Research and Education brought the world's leading experts together on a virtual stage to share knowledge to combat the pandemic, which has changed our daily lives. Today, on one side of the globe, we have daily vaccinations topping 2 million in the US, while in India, there's a crush of over 400,000 and likely many more cases. So much has happened in the course of one short year. We invite you and our expert speakers to reflect on lessons learned and how to take those lessons and plan for the future. I'm very pleased to introduce Dr. Michelle Berry, Director of the Center for Innovation and Global Health, to kick off our conference. Dr. Berry is the Drs. Ben and H.S. Shenson Professor of Medicine, Senior Associate Dean in the School of Medicine, Professor of Medicine, and Senior Fellow at the Woods Institute and at the Freeman Spogli Institute. Welcome, Dr. Berry.
Thank you for that introduction, Dr. Lee. Good morning, good afternoon, or good evening, depending upon your time zone. It has been 1 year since we first gathered at this conference to make sense of a new spillover event resulting in pandemic illness. I recall the breakneck speed of news this time last year, every day bringing darker omens for society, the economy, and human well-being around the world. And at the heart of it all, so many questions and so much uncertainty. Today, that uncertainty has eased somewhat. There's still a great deal that is unknown and a hazy future ahead, but we also have much to learn from and good science to inform our next steps. It is easy to look back on the past and say that we failed in so many ways. And there have been failures, tragic and irrefutable, but we are scientists and we learn from mistakes as we go forward. I had the privilege of moderating a keynote conversation with Dr. Tony Fauci, and we agreed that we were watching science happen in real time. And for every failure or mistake, there was a lesson to be learned, as well as a future opportunity to apply these learnings and if we were lucky, to save a life down the road. So what have we learned in the last year? I can't speak to what our colleagues will say here today, but I want to share with you what I have learned. First and foremost, I've learned against the resounding importance of global conversation and cooperation. We learned that the international coordination is not only necessary to slowing and stopping the pandemic, but also to trying to achieve equitable management. Empowering organizations like WHO, Gavi, the Global Alliance Vaccine Initiative, COVAX, the consortium of countries trying to allocate vaccines equitably, is the first step towards the scientific and political cooperation needed to end this pandemic and prevent future ones. I learned the true importance of the health of our world's ecosystems, particularly around animals. This term that's used, One Health, is really about the optimal health for people, animals, and our environment. And it's at the heart of COVID-19 and its spillover from bats. Habitat loss, land use changes, and animal well-being, both wild and domesticated, are all concepts that need to be studied, better studied, and stewarded. On a more technical level, the need to closely track variant mutation in the novel coronavirus has proved to be essential and will continue to as vaccine distribution is rolled out. More likely, coronavirus will settle in and simulate flu infection with a need for annual vaccination, and thus continual monitoring will be needed to be maintained in order to tweak vaccine development for effective coverage of new variants. We will need then global collaborative genomic sharing, as well as greater transparency and coordination in case recording and demographics. And we need equitable distribution of vaccines both now and in the future. Doing less means that enormous populations will continue to fall through the cracks and stoke the fires of this pandemic. This year, I was also reminded of the urgent need to counter misinformation effectively to prevent fears of vaccination. It is our responsibility in the medical community to expect and prepare for adverse events in vaccine rollout. And we've already seen that. But we need to create plans to pause distribution and communicate the facts without engendering more distrust, and that's really of utmost importance. At the same time, vaccine nationalism and soft, insidious power dynamics of vaccine distribution proved to be a predictable, unfortunately, but nonetheless a disturbing international force. Moreover, impactful communication remains a shortcoming of the medical community. Vaccine equity and vaccine hesitancy would be less of a problem if we could effectively communicate our research and scientific understandings in a unified messaging. This pandemic has also exposed weaknesses in the US and in Europe, while at the same time shining light on the global South. While our shortcomings are tragic, the achievements of low and middle income countries that have effectively stymied the virus, such as in Rwanda and parts of Africa, must be celebrated and studied and replicated. COVID-19 may very well usher the end of American exceptionalism, which we can decry as an end of an era, or we can embrace it as a renewed opportunity to learn from and collaborate with our peers, who you will hear from during this conference. Looking back, there is so much I wish we had done differently, but COVID-19 didn't only cast these shadows, it also showed us our resilience and our collective competence. Over the last year, we overcame odds and proved that we are capable of the incredible and the improbable. Our unprecedented race to a vaccine has shifted the idea of what is possible in vaccine technology. And it's given me immense hope for the future and optimism of more challenges that we will face ahead. When we work together, when we harness all our will and expertise, we are capable of great things. There is no challenge we cannot overcome if we put our collective efforts to it, whether it is scientific challenges like climate change or future pandemics, or the social challenges that continue to plague our society, like health inequity or racial injustices. Those have been my learnings since we last gathered, but today we'll have the opportunity to hear from experts around the world and learn from their experiences and apply them today and in the future. We have fantastic panels and speakers and so many important voices to hear from. The pandemic is far from over and there's still much to do, but I have to end with saying my heart goes out to those of you who are joining us from India and the many places around the world that continue to face resurging COVID-19 cases. I hope that we can share something of value today, lessons that can be applied globally and to great effort.